Well, hi there. You know, in the last video, I asked you some questions to help you set realistic expectations of what nursing is like in 2025. And I just know that you did your homework, right? Like you did some soul searching. You talked to nurses around you about their jobs, their pain points, how rewarding or unrewarding it is. You watched some day in the life videos, right? Okay, great. So now that you've done all that, I trust you. I'm gonna take you at your word. We're gonna go through all of the different degrees and certifications that lead to nursing, okay? I'm gonna break down these pathways because not all nurses have the same credentials, education, or type of degree. So we're gonna go from the shortest programs to the longest programs, and we're gonna cover what the titles are, what the requirements are, what your pay is gonna be, what time it takes to finish, and the description of what someone does in that role. But before we begin, I just want to introduce myself. I'm Tiff. I'm a BSN RN. I switched careers in my mid-30s and joined an accelerated nursing second degree program that almost took me out. If you are interested in joining nursing as an untraditional student, if you are a nursing student and you like study guides, study sessions, things like that, or if you're a healthcare professional looking to get into healthcare related business, I did assisted living for many years. Your girl, you just might as well go ahead and subscribe now. We're gonna be besties, we're gonna be friends, okay? So let's get into this nursing tea. How many ways can we get into nursing? Most of my information was pulled from the ANA. A lot of information was also pulled from the BLS. So starting with the shortest, I know this is controversial, but I began as a CNA. I'm putting this on the list. CNAs, or certified nursing assistants, also known as nursing aides. They are not nurses, okay? But this is an entry point to nursing, and it's a great way to get experience before getting into a nursing school. We're all on the same care team. I'm gonna include them on this ladder. And instead of seeing it as a ladder, I'm gonna look at it as like a care team circle. Requirements for CNA, you're going to need a high school diploma or GED. After you finish this program, you will get a certificate of completion, and you may or may not have an exit exam or skills exam based on which state you're in. The timeline for getting the CNA is going to be 4 to 8 weeks typically. And what CNAs do? They do ADL support. So those are activities of daily living, like feeding patients, bathing patients, dressing patients, helping patients with movement. They may also clean and prepare rooms in a hospital or a nursing home. They can transport patients, like from their bedroom to radiology to get x-rays, for example. Or they may transfer patients, like moving their body from their bed to their chair, from their chair to their wheelchair, back and forth to the restroom, things like that. Some healthcare systems may vary, and some nurses' aides may have more responsibilities, like they may do vital signs, they may do blood glucose checks, and things like that. So the median pay for a CNA in the United States is $38,000 a year, or $18.33 per hour. This is taken directly from the Bureau of Labor Statistics. When I worked as a CNA, I think the average payback there was $15 to $20 an hour, and that was in the state of Maryland. If you're interested in what it is in your area for any of these positions, type in the name of the position, type in your zip code, and look for something on Indeed or another site or on Reddit, and they'll tell you what people are making in your area. Now, the benefits to starting as a CNA is you're gonna have close proximity to nurses, so you can see what they're doing on a day-to-day basis. You can also even confirm or rule out if you wanna go further through the nursing pathway in healthcare, or if you wanna take another pathway like a speech language pathologist, for example, or a respiratory therapist or something like that. So another benefit is that you get really good healthcare experience, and that can actually make you a better candidate to get into nursing schools with that CNA. And some hospitals will do tuition reimbursement for CNAs that are ready to go back for their RN license. Drawbacks for being a CNA: the work can sometimes be repetitive and boring. I'm speaking from personal experience. And you do need to be strong, like physically. Like, of course, mentally you can be strong, physically, you definitely have to be strong because you're going to be moving patients around. You're going to be changing them. You're going to be changing their sheets while they're still in the bed, which is going to require you to like roll them in different positions. And honestly, the drawback is sometimes there is a lack of respect between the CNAs and the nurses on the floor, or the CNAs and the physicians. Just sometimes, even though we're all healthcare professionals and we're working on the same team, I experienced that directly. So I'm careful, to just not overstep boundaries or be disrespectful to anybody on the healthcare team. So next we have our LPNs and LVNs. We love them. Yes, we do. An LPN is a licensed practical nurse. An LVN is a licensed vocational nurse. What is the difference? There is none. It's the same exact title. It just depends on what state you're in, what they call it. These are also called diploma nurses. So your requirements to get into, an LPN or LVN school is going to be your GED or high school diploma. And your high school diploma must include specifically science and math classes, so like biology. So for your LPN program, sometimes a TEAS exam is required. I know that sounds crazy, but I'll put the title for the TEAS up here. But there are no courses or prerequisites required. And being a CNA or any other healthcare experience can help you stand out in the applicant pool for LPNs. After you complete this program, you get a certificate, and you must take the NCLEX LPN at the end of your program to be licensed. So you get a certificate when you graduate your program, and then you get a license when you pass your NCLEX LPN. The time frame for LPNs and LVNs is roughly 1 year, give or take a few months depending on what school it is. And in this role, what you're going to do, you're going to have more hands-on skilled patient cares at this level. You're going to be definitely doing all your vitals. You're going to be doing blood pressure checks, glucose checks, catheters, changing dressings, turning patients. You are going to do some ADLs, and you can at this level communicate with the family on behalf of the care team. The median pay for LVNs is going to be $59,000 a year, or $28.72 per hour. The benefits is that this is the fastest track to nursing with no prerequisites required. And classes are more likely to be overnight or weekends because this is meant to be a degree to accommodate people who are already working. You can get a job with an employer that will pay tuition reimbursement to bridge to your RN. And also you can work in more of a variety of places than CNAs typically. So you don't have to be in a hospital or a nursing home, but you can be in a doctor's office. You can do private duty care as well, independently. Now, the drawbacks is that some states or some individual facilities might require you to complete all of your nursing tasks under direct supervision of a nurse, a registered nurse, or under like an advanced care practitioner or a medical doctor. So there are state-by-state laws on this. In some states, LPNs cannot do like your initial assessments upon admissions. They cannot do assessments after a change in status. So if someone falls, that's called like an adverse event, they wouldn't be the person to be able to check to make sure that person's okay. It would have to be a registered nurse in some places. In some places, you cannot take unstable patients as an LPN. You can't really do patient education or discharge. So you can't really talk to them about why they're on this med, what their condition is like. And also you can't hang like blood transfusions or give high-risk medications. And again, this is all state-by-state basis, okay? So registered nurses, RNs, this is most commonly what people think of when they hear the term nurse. So the requirements here, high school diploma or GED plus prerequisite classes. And when you finish this program, you'll either earn an ASN, an associate's degree in nursing, or BSN, a bachelor's degree in nursing. And in addition to that degree, you have to sit for the NCLEX RN to become licensed as a registered nurse. So our LPNs had to take the NCLEX LPN. These registered nurses had to take the NCLEX RN, whether they went to an associate's degree program or a bachelor's degree program, they have to take the same NCLEX. So the time here is going to vary depending on the program you pick how long it takes to complete your prereqs as well. So it can be from 1 to 4 years. And what you do as a nurse is limitless, honestly. You get a wide variety of tasks that are all going to be related to executing orders from advanced practice practitioners, medical doctors, DOs, etc. Or you can work completely outside of patient care as well with your RN. So you can do skilled patient care, wound care, start IVs, maintain, drips. You do assessments, you do care plans, you give medications. You are required to advocate for patients, as in it's your personal responsibility. If you get orders that are contraindicated for a patient, meaning it goes against what their illness is or maybe other medications that they're taking, it is your responsibility to advocate and to question that order. Even if it's unclear, it is your responsibility. But you can also do patient education, you can do public health education, you can do research, you can do care coordination where you're not hands-on dealing with the patient themselves. There's so many different tasks that registered nurses do. You also delegate tasks to your CNAs and your LPNs as well. It's just a lot that you can do, but what you can't do is generate your own orders and diagnose patients. You cannot do that. You work off of existing orders if you are dealing with patients at all. The median pay for a registered nurse in the United States is $86,000 a year or $41.38 per hour. Now, the benefits of becoming a registered nurse, you're gonna have more autonomy and more ability to problem solve than an LPN or a CNA, of course. And you can work in a number of different fields and specialties. You can be in neonatal intensive care units, also known as NICU. You can be in neurology, you can be in an operating room, you can be in psych, and you can also fulfill non-direct patient care roles where you're not necessarily even dealing with the patients directly. So you can work in administration, you can do medical authorization and prior auth, you can do public health nursing, research, work from home jobs, just everything. Another benefit is the job stability. Like, many states are unfortunately pushing to eliminate that LPN, LVN role, and they're requiring all nurses to be bachelor's prepared nurses or even associate's degree prepared registered nurses. And another benefit, of course, your employer can pay for grad school if you want to go back at this level. It's more common to get tuition reimbursement because they want you as an advanced practitioner at their hospital or organization. Some of the drawbacks is more schooling. The BSN program, some of the educational components of that have nothing to do with patient care whatsoever. You're learning about the history of nursing from like the 1800s forward. You're learning about, all types of stuff, insurance, billing. You're learning more things that have less to do with patient care. And some people don't like that. That would be a drawback to them. It takes a longer time to earn that degree. These programs are highly competitive. Another drawback is the amount of prereqs that you have to do. Like, you need to have great grades in those prereqs most of the time. And it can be a highly stressful job. The patient ratios in some units or hospitals or even regions are crazy what's accepted and what's the norm. So that is one of the drawbacks. Now, as far as after your RN, there are several advanced nursing degrees. This video is already getting a little lengthy, so I'm going to make a third part of this series covering all of your post-BSN, post-RN graduate school options. That was a mouthful. There are so many different ways to become a nurse. If you enjoyed it and if you learned anything valuable, I ask you very humbly to please like this video and please subscribe to this channel for nursing content that will inspire you to get to your next level, whatever that may be. Remember this, okay? I believe in you. You can do anything that you put your mind to, and you are simply incredible. So I'll see you in the next video.